The SABC News, we're in the facts business. And when dealing with COVID-19, by many accounts, it's important to make decisions based on scientific facts. And there's, as you know, a lot of disinformation, fake news out there. So let's try and separate the facts from the fiction and bring in a person in the know. Dr. Sandile Mhlongo is the managing director of Akeso clinics at the Netcare Group. Dr. Mhlongo, a very good morning to you.
Morning. Thank you for having me.
It's a great pleasure to have your perspective on the program. Look, help us navigate through this path which is often littered with misinformation and conjecture. So I'll throw some questions at you that are gaining traction, and you give me the best possible answer based on the best possible data available. You good with that?
I'm good with that, thank you.
All right. Doc, so one of the big things now is people talking about masks. Wearing a surgical face mask, will it keep you from getting sick?
That's a very good question. I think as a starting point, there is no evidence anywhere in the published literature that suggests that actually widespread wearing of masks is going to reduce the risk of transmission. But for certain select groups of our population, there is advice that they should wear masks. So, for instance, healthcare workers who are dealing with patients who are likely to be suspected cases or confirmed cases should be wearing protective masks, as well as patients where they actually are suspected as a carrier or infected or already tested positive to prevent spread to others. But if you are a healthy individual walking about in the street, there's absolutely no evidence that suggests that the masks are beneficial. In fact, what it does is that it constrains the supply chain, and therefore there's a massive shortage for people who are in need of masks. And it's actually, as a public health issue, it's causing more damage than good.
Right. And there is a difference between these various masks, isn't it? There's the surgical mask, and there's something called the N95 mask, which is often used by medical health practitioners. Talk to us about the difference and how effective are they?
So the typical mask that everybody tends to see is a surgical mask that is used primarily to prevent droplet spread. So, for instance, if I'm speaking to you, there will be minor droplets of saliva coming out of my mouth, or if I'm sneezing or coughing, the droplets that come out. The mask is very useful in preventing that transmission through that, because it's the disease, as we know, is mainly spread through droplets. Yeah. The N95 mask is a specialized mask that has actually a membrane that's fitted inside it that's actually much more important for airborne diseases. So those that are actually very minuscule or very small, but actually are spreading through the air. So that is also, again, a very useful mask in specific circumstances where the load of the virus in the air might be very high, so therefore it has a HEPA filter that actually prevents transmission through it. Whereas the standard surgical mask is what is advised when worn and fitted properly for, as I explained earlier, for select and the right groups of people. It is useful to prevent the droplets spreading from one person to the other.
And is the N95 mask readily available? Can the public get it?
To the best of my knowledge, these are typically supplied to healthcare professionals. But I guess actually one could actually, especially in pharmacies, obtain it. But again, as I said, it would be actually just a wasted resource. So I would rather actually add that if you go to a healthcare facility when it is appropriate for a particular person to wear the N95 mask, the healthcare facility is likely to provide you with the appropriate mask and help you fit it correctly as well. So it's not about just wearing the mask. There is fitting that actually people need to be trained and shown how to fit the mask correctly, and also how to put it on and remove it once you've worn it, because there's nothing more harmful than wearing the mask the whole day. You keep touching it, and obviously you might have actually had droplets that contain the virus staining on the mask, and you hold the mask itself, and the next thing is you don't wash your hands and you therefore infect yourself. So there is a technique, and therefore I would rather advise the public to, if there is any concern, contact your healthcare professional who will advise you appropriately what measures to use to prevent contracting the illness.
Yeah.
The safest approach currently that has been published and we communicate to the broader public is hand hygiene, social distancing, and respiratory etiquette when you're coughing or sneezing. That's what we know, and that's what seems to be working in terms of stopping the transmission.
Doc, if a person doesn't present symptoms, are they infectious?
Yes, we do know that actually about 1% of the population from the publication from the Chinese epidemic, 1% of the population was asymptomatic, but they were transmitting. And there's a few studies that have already been documented, small case studies that have documented where patients were shedding the virus and it was cultured in their saliva, and therefore they were infecting. And in some instances, in clusters of communities, where a person who was asymptomatic was the only presenting case that was positive, infected people within the family. So it definitely does happen. It's not the most common form of transmission, but it does happen, and therefore before you are symptomatic, one should be aware that you could be shedding the virus and therefore transmitting it before you know that you are sick.
Yeah. What about gloves, Doc? You see a lot of people of late using these gloves. Are they helpful in protecting oneself from COVID-19?
Again, it's one of those myths that actually is absolutely of no benefit. In fact, when I observed people just in the community who are wearing gloves, they tend to actually forgo the standard practice of hand hygiene. So they feel that actually by wearing gloves, they can move from pillar to post. They touch here, they touch there, and it makes it difficult, obviously, to remove gloves, wash your hands, and so on and so forth. So, but there is no data that suggests that actually we should be wearing gloves as a preventive measure. What we do know that definitely works is frequent washing and thorough washing of hands, even with soap and water. We don't. There's a lot of widespread shortage of alcohol-based solutions, but soap and water is washed thoroughly and properly is sufficient to actually provide appropriate hygiene for your hands. So the gloves, in fact, could be, and as well as the mask, could be providing a false sense of security, and people actually lessen on what is shown to work and focus on things that they think might work, but in fact could put them at risk and their families at risk.
Yeah. This I've heard doing its rounds as well. Drinking water every 15 minutes will flush out the virus. True or rubbish?
Absolutely nonsensical. It's laughable actually, but there is. So one has to separate the issues around what you need to do to ensure that you stay healthy, be it you infected or not infected. So obviously we have to advise the public to stay hydrated, to stay as healthy as possible. But to believe that drinking water or gargling with warm water and salt water is going to reduce the virus, there's absolutely no data. And in fact, the WHO has published on their website a number of these myths that are circulating in the general communities or in the general population that there's no data that this works. And so people, in fact, actually for some people, drinking too much water may also put them at risk, especially if you have heart disease. So we should actually be cautious, and therefore guidance from your healthcare professional is the most appropriate way to understand what you should and shouldn't do.
I know garlic in general is good for you, but there's something going around that's saying, gargling with garlic or salt water can kill the virus before it reaches your lungs. What's your take?
No. Definitely also a myth that has to be corrected. The garlic is a very potent and healthy food component that boosts your immunity in general. So, of course, then if you're using it to just help your immune system get stronger, and there is some data that suggests it has antibacterial properties, so meaning it can help fight off some common infections. But as far as the novel coronavirus is concerned, there definitely isn't any suggestion that actually it is amenable or it will be muted by actually exposure to garlic. And in fact, this is a virus, so bacteria and viruses being different organisms, one cannot apply what commonly works for bacteria and with viruses.
Dr. Mhlongo, can the virus survive on money? I mean, I want to find out how long does the virus live on surfaces of something, and the difference in terms of the different surfaces such as steel and wood, etc. Well, what's the studies telling us?
So, the challenge here is that this is a very new virus. It was only discovered in December of 2019. And we only have some emerging data and some suggestions through some laboratory testing and experience, especially in countries like China, who have gone through the worst of the epidemic. So there is a study that was recently published. I think it was published sometime last week. That actually just demonstrated the survival patterns on different surfaces. So definitely, it does survive on surfaces. Different surfaces have different survival periods, and what the study suggested is that actually on stainless steel, for instance, it can survive up to 5 days.
Right.
On copper surfaces, it survived actually less than 1 day. So as we know more about this, I think the data is going to give us a lot more guidance. But I think what we do know and what the public should understand is that definitely it will survive. And I'm going to use paper money or coin money as an example here. What they were testing was on cardboard. It definitely survived around 3 to 5 days. And so what the public should know is that actually decontaminating surfaces, so in other words, cleaning thoroughly with alcohol-based solutions becomes an important mitigation factor or risk-reducing factor even in the home or at work or wherever we aggregate. And therefore, for healthcare facilities, we apply the same logic that you have to clean thoroughly and decontaminate surfaces because the virus definitely survives.
And this liquid that we use, it needs to contain over 60% of alcohol, correct?
That is the recommendation, that between 60 and 90%, 95% alcohol. Although I saw a publication recently that says actually the higher the concentration does not necessarily above that range of 60-70%, there doesn't seem to be an additional benefit. So, but actually a high concentration of alcohol around 60-70% is what's currently recommended, and that's what you should use. But again, if you don't have access to that, thorough cleaning with soap and water is adequate to decontaminate. And I think maybe what's important also to understand here is that in any inoculum, so what I mean is by that is if you have exposure to a contaminated surface, you do require obviously a concentration of the virus or the viral particles for you to actually succumb to the infection. So decontaminating and cleaning reduces that viral load. So therefore, even if it may still be present, it has reduced the load that actually can lead to an infection. So people should continue cleaning surfaces and practicing hand hygiene thoroughly to ensure that they decontaminate as far as possible.
Doc, I want to keep you for a little bit longer because you're answering a lot of questions that people have with regards to COVID-19. I want to know how fragile this virus is. The fact that it can live on these surfaces for so long, is it necessarily pathogenic, be able to cause disease?
Definitely, that's what we are seeing. So, and perhaps actually to lessen the panic that we are seeing, I should provide some statistics that were published by the Chinese CDC. What we know now is that 4 in 5, or 80% of the population, get a mild to moderate illness when they're infected with this virus. So for 80% of the population that contracted the illness, will have mild to moderate. They don't even need to be admitted in a hospital. With self-isolation at home and protecting the ones around them, that is sufficient. They will get through the illness and recover smoothly. About 14% require hospitalization. So that's 1 in 7 require hospitalization. And another 5% are severely sick, and they require hospitalization in an ICU with mechanical ventilation and system support. So the virus definitely causes illness, so it's pathogenic. And the studies are comparing it to the virus that caused the epidemic, the SARS epidemic in 2003. So what we know is that actually it does survive, and it's definitely pathogenic, but what we are seeing in terms of the epidemic is that it's much more contagious. So it infects people at a much higher rate than the SARS virus in 2003, as well as the MERS virus that emerged in 2013. So it is highly contagious, perhaps slightly less virulent than SARS, because if you look at the death rates, they're slightly less. But there is a subpopulation that actually it's very dangerous for, and those are the older population. We don't know what the cutoff is, but we certainly see a trend that above the age of 60, it's very dangerous. The illness there is much more severe, as well the people with chronic illnesses like your asthma, your diabetes, your kidney disease, your heart disease, liver disease. Those patients seem to get a much more severe illness, and therefore that's where you're seeing a higher death rate than if you look at the population as a whole. In the younger population, as much as they get the illness, younger kids seem to not get the more severe illness. We don't understand why. There's still a lot of research that needs to happen here. But we're seeing that younger kids, especially under the age of 10, seem to actually get a milder disease, and the survival patterns, if you just look at the distribution, is much better the younger you are or the healthier you are. So, of course, in South Africa, we have a complexity with the existing epidemic of HIV, where a significant proportion of our people are immunosuppressed. So we've got to then balance those risks that actually what we know from the Chinese population is not necessarily going to be applicable here or anywhere else in the world, because we have a different dynamic. So, but for most people, they will be infected, they will have symptoms, and the symptoms, as explained in many other sources, fever, cough, and shortness of breath. There will be a mild to moderate disease that does not require any admission into a hospital.
Doc, before I let you go, I just want to get through this last question with regards to local transmission. We've heard it of late from the statements that have been released from the health minister. What's the meaning of local transmission? There's also another term that is used, and something called community spread. Give us the difference between local transmission and community spread.
So, more or less, they imply that they implicate the same kind of situation. So, let me just use the scenario that we went through in South Africa. We know of the first case. It was widely publicized. So, the first case was a person who had traveled to the north of Italy and came to South Africa. It was the first documented case. So, by definition, that was an imported case in South Africa, although he was confirmed and diagnosed for the first time in South Africa, because the virus had not existed yet in South Africa, that we would classify that as an imported case. And then, of course, that person will interact with other people before he's sick. So, as I explained earlier, while asymptomatic, he may be transmitting the disease. So he would have bypassed, for instance, our screening processes through the airports, where he doesn't have a temperature, so therefore he'll be coming in as any other person, because he's got no symptoms. And if he infects, if he goes home and actually then before he knows that he's got the illness, or even after, if he's actually coughing and he's spreading it to the people around him, that then defines a new pattern of transmission. So in the local context, it's then you describe that as community transmission. So in an environment where you already have the disease and it's spreading from one person between, let's say, from this house to the next house, and you can trace that those people interacted and there were close contact, then you label that as community or local transmission.
Such important.
Which is different to importing the virus from a foreign geographic location.
Right. Such important information, Doc. No doubt we'll try to bring you back onto the program to dispel, I guess, more myths that's been doing its rounds. I guess, the saying goes, danger is real, fear is a choice. I think Will Smith said that at one stage. But I guess, factual information will help in making that choice. Dr. Sandile Mhlongo is the Managing Director at Akeso Clinics at the Netcare Group. We appreciate your time. We appreciate your insight. Thank you. Be well. All right.